नमस्कार। आशा करता हूँ कि आप सभी स्वस्थ होंगे। अभिनंदन करता हूँ। जैसा कि हम सभी जानते हैं कि अक्टूबर का महीना हम लोग ब्रेस्ट कैंसर अवेयरनेस मंथ के रूप में सेलिब्रेट करते हैं। महिलाओं में पाए जाने वाला मोस्ट कॉमन कैंसर है, भारत में ही नहीं समूचे विश्व में। सो ग्रेट दैट इट हैज क्लेम्ड अराउंड 85,000 लाइव्स इन फीमेल इन इंडिया इन लास्ट ईयर will develop CA breast in our entire lifespan. To discuss this, we have with us Dr. Ashish Goel, sir, who is Director Surgical Oncology at Jaypee Hospital, Noida, with his vast experience of around 25 years in the field. Sir, how common you see CA breast patient in your clinical practice?
So we talk about cancer breast. So as you may like, 1 in 25 women in their lifetime up to 70 years would develop the most common cancers in women, especially in urban population, as well as the most common cause of cancer-related death. In fact, many people feel that breast cancer is common only in elderly patients. Do occur in younger women younger than 40 years of age. Numbers in age 30 to 40. And in fact, one of the youngest patients which I
So generally, when the patient walks in an OPD, the first question she asks, "Doctor, why only me?" So what are the risk factors?
being women. The other risk factors will generally include some hormone-related changes in the body, such as too much use, over excessive use of oral contraceptives, hormone replacement therapy, and especially who have had late marriage, late childbirth, who have not breastfed their children, and so on and so forth.
Sir,
And there's also some evidence of obesity in breast cancer in the recent studies.
Sir, alarming signs or symptoms that we should bring out that the woman
Lump, that is a lump or bump in the breast. But that does not mean that a woman who doesn't have a lump in the breast cannot have breast cancer. The other signs and symptoms would include any increase in size of the breast, any change in size, shape, contour of the breast, thickening over the skin of the breast, and something which we in our medical terms.
So, sir, regarding this, one of our viewers regarding this want to know: Thus, is every breast lump cancer?
Of these lumps may not be cancer, but whenever you have a lump, you need to go to a specialist, meet the doctor, get adequate investigation. So my advice, even for younger women, is they should consult a surgeon or an oncologist and adequately investigate. So that would be basically by doing an
By which we can prevent this cancer from happening in the females.
So there is a cancer screening program. The advice is to do a breast self-examination once a month, that is while changing any lumps in the breast. And for women more than 40 or 45 years of age, all women should undergo an annual screening examination, screening mammography, and also clinical examination by an oncologist.
The viewers related to this wants to ask that her mother was a case of CA breast. So what are the chances in her that she can also develop malignancy?
So if we talk about hereditary cancer, जो genetic cancer percentage, यानी out of 100 cancers, only alarming factor, any woman cannot. But in case your mother or any relative from your mother's side, that is your mother's sister or your cousins, have had a cancer, of a screening program.
So generally, what we have heard that in a normal population that जो कैंसर होते हैं busy lifestyle or we are so busy on a day to day, we are the most ignored group. So sir, how common is breast cancer? Okay. So sir, is breast cancer a disease only of females, or male can also get CA breast?
So very nice question. So males also, we classically say that only 1% of all cancers which occur in males. But the treatment, the diagnosis, the pattern.
She should undergo ultrasound, mammography, and evaluate options for a carcinoma breast.
So once you have a lump in the breast, you go to a doctor. You need to confirm the diagnosis. So which is by a mammogram, to undergo a fine needle aspiration cytology. But currently biopsy is the standard of care, which is a true cut or a needle biopsy, and mostly it should be done under ultrasound. Also need CT scans, mammography. But the good thing is that breast cancer is now becoming curable, and we have a lot of advances in chemotherapy, radiotherapy, and surgical principles for cancer. So especially for early stage cancers, that are patients with small lumps, no lumps in the time when breast cancer meant doing mastectomy, that is removing the whole breast. But in this situation, most of these patients we can do a conservation of the breast, which means we only remove a part of the breast around the tumor, and we look for the lymph nodes, the glands in the armpit by sentinel node biopsy, good cosmetic outcome in order to maintain a good size, shape, and contour.
So one of the viewers have asked that when we are doing a biopsy of cancer, or This is a common myth that we came across every day in a day-to-day
So
practice.
this is a myth, and this is one of the reasons why people delay the diagnosis.
Yes.
So this is certainly a myth, because doing a biopsy, looking at the cells of the cancer in the microscope, that is the only way to confirm. So I want to operation or biopsy does not spread the disease.
Okay. So, mainly all the questions are whatever chat sir has answered them. Sir, one last and final message that you can give to all of us, so that for the awareness that.
So my take-home message for all of you would be ears and do a breast self-examination. Thank you.
Thank you, sir, for guiding us and enlightening us. And we at Jaypee Hospital, the team, the comprehensive pathologists and radiologists will ensure this for you. आशा करता हूँ कि आप इस मैसेज को ज़्यादा से ज़्यादा लोगों तक पहुँचाएंगे और खुद को और अपने परिवार को संपन्न रखेंगे। नमस्कार।